start. These numbers of blood you have to remember as you remember your names. Yes, red blood cells in male and female, and hemoglobin in male and female. And remember, please, that red blood cells are powered by 12. For example, 4.2, 5.3 multiplied by 10 powered by 12. Next, WBCs and thrombocytes means platelets. They are powered by 9. For example, WBCs is leukocytes, other name, from 4 till 9, maximum till 11, multiplied by 10, powered by 9. Platelets also 180, 320, multiplied by 10, powered by 9. These measurement could be different individually, but this is an average. Understood? Now look, we said that how to treat anemias due to deficiency of something. For example, iron deficiency anemia, we give oral or parenteral iron drugs. For example, oral is ferrous sulfate, ferrous glutinate, ferrous fumarate, and parenteral dextran or iron sucrose, for example. This is parenteral. How to treat B12 deficiency anemia? We give cyanocobalamin for B12 deficiency. We give this B12 to treat B12 deficiency and neurological problem defects. But we can treat B12 deficiency anemia by folic acid. But folic acid can treat just anemia, not neurological disorder. Understood? This. Now look, please. What about to treat anemias due to bone marrow inhibition? Bone marrow is inhibited. How to treat this anemia? We give drugs which stimulate bone marrow production. For example, to stimulate RBC's production, red blood cells production, we give epoetin drug. Epoetin, it's similar to erythropoietin. Yes, epoetin, similar by name to erythropoietin. Erythropoietin is a hormone which produced in kidney and goes to bone marrow and activate red blood cells production. Imagine the patient has kidney failure, he will have anemia due to erythropoietin deficiency. We give epoetin, for example. But in this case, if we increase bone marrow production, we have to measure continuously under control hemoglobin. Hemoglobin should not be more than 12, means 120. Because if he will become more than, hematocrit of blood become increased. And then blood viscosity become increased. It can lead to blood clotting. That's why under control. This is about red blood cells stimulating. What about WBCs, leukocytes, if we have inhibition bone marrow? We give these factors, stimulating factors. Granulocyte colon stimulating factor, filgrastim, and granulocyte macrophage colon stimulating factor, sargramostin. First one purely for granulocytes. Granulocytes means basophil, eosinophil, neutrophil. And second one for granulocytes and macrophage. Macrophage is monocyte. About platelets, how to increase production of platelets if we have inhibition bone marrow, we give drugs which stimulate megakaryocyte production in bone marrow. This is the drug oprilvicin. But also in platelets, we have to be attention, because if we increase platelets production, it can lead to what? To thrombosis, clotting platelets. In general, if we give any stimulating drugs for bone marrow production, they have some signs, not side effects, signs. It can lead to some bone pain. We feel bone pain. Why? Because it's activation of bone marrow, then bone pain. Where is bone marrow? Inside bone, yes? Then we feel some bone pain. What about if we have if we have more platelets? For example, we have thrombosis occur already, clotting. How to treat this? we give anticoagulation, antiplatelets, and fibrinolytic drugs. Antiplatelets is aspirin, and fibrinolytic is streptokinase, and heparin is anticoagulant. This the standard treatment for myocardial infarction, for example. Myocardial infarction. For myocardial infarction, if the patient already has heart attack, myocardial infarction, we have two types of treatment. First, the immediately treat, means on street, at home, in ambulance. What we give? We give Mona. Mona short. What is Mona? Morphine to remove pain, oxygen, nitrate, and aspirin. This is first immediately management treatment for myocardial infarction. Then we get this patient to hospital. In hospital, we give heparin in system, is slowly dropped. And inside this system, we inject streptokinase fibrinolytic to break down the thrombus. This is what I wanted to say about this. Thank you very much.